My pleasure. So disturbingly, though not particularly unsurprisingly, Trump has picked three of the chief architects of the anti-science movement to lead key health agencies under the Make America Healthy Again, or MAHA mantra. So he has selected Dr. Mehmet Oz, a former cardiothoracic surgeon turned junk science talk show host, to lead the Center for Medicare and Medicaid Services, and a person who also has a lot of deep ties, ironically, to industry, which we'll talk more about. Also, Dr. Jay Bhattacharya, a Stanford MD, PhD health economist and the chief architect of the Great Barrington Declaration's herd immunity tactic during COVID-19, to be the person to lead the National Institutes of Health. And the crowning jewel of his appointments, someone with no specific medical or scientific credentials, RFK Jr., a major leader in the national and global anti-vax movements, to lead Health and Human Services. Additionally, he recently nominated Marty Makary, I don't know if I'm saying that right, but to lead the Food and Drug Administration, a Johns Hopkins surgeon who was a vocal critic of the FDA during COVID, first for being too slow to approve vaccines, and then urging them to change some of their recommendations around vaccination for young males. So these appointments, coupled with the recent Supreme Court decision to overturn Chevron deference, are anticipated to have a substantial chilling effect on administrators' ability to carry out science-based policymaking without political interference. So just as a reminder, Chevron deference previously allowed courts to defer to federal agencies' interpretations of ambiguous statutes by recognizing their expertise in specialized areas like healthcare, but the Republican-dominated Supreme Court recently overturned that decision. And so that now has reduced the amount of discretion that healthcare administrators have in making science-based decision-making. Additionally, Trump already announced the establishment of a new Department of Government Efficiency, or DOGE, to be headed by the oligarch Elon Musk and former GOP presidential primary candidate Vivek Ramaswamy, in an effort to stop the government's, so-called wasteful spending. Meanwhile, Musk's investments in Tesla and SpaceX have received substantial government subsidies. As part of this government efficiency initiative, there are anticipated to be major cuts and reorganizations to the National Institutes of Health, which could have really devastating downstream effects on schools of public health and academic medical centers that rely on these funding sources, as well as devastating effects on health research more broadly. Going beyond these nominations, Project 2025, which was this project put together by conservative think tanks that lay out a blueprint for what we are likely to see during a Trump administration, has laid out a lot of the different policy agendas that we can expect from a Trump administration. And concerningly, this Trump administration will be virtually completely unobstructed in its ability to implement its preferred policies. So I was doing a little sleuthing on this, and I think that this is the first time since at least the 1930s that Republicans actually have a quadfecta. So not just a trifecta where we have, the presidency and the House and the Senate, but actually also the Supreme Court are all under the control of one party, in this case, the Republican Party. So it has virtually unlimited authority to implement its mandate. So among other things, that the mandate within Project 2025 includes things like making Medicare Advantage the default enrollment option. So, further endorsing Medicare disadvantage, as we like to call it. Potentially block granting Medicaid and adding back unnecessary work requirements and tightening eligibility requirements around Medicaid, as well as the potential to once again, just try to completely dismantle the Medicaid expansion in its entirety. Project 2025 also includes myriad proposals to further ingrain and expand abortion restrictions. If you read Project 2025, like peppered throughout the plan are different ways to add in new abortion restrictions, and also setting their sights on trying to ban gender affirming care for minors. And also extensive proposals to completely restructure the CDC and the NIH in ways that give it less independence and introduce further political controls on what scientists can do and say. And additionally, just last week, the Republican-controlled House passed a bill, H.R. 9495, that would allow Trump's Treasury Department to label any nonprofit, including human rights groups, civil liberties organizations, universities, student groups, and even potentially Physicians for a National Health Program, a terrorist supporting organization, and strip it of its tax-exempt status. So this is one of the more disturbing turns towards really conditions that are undermining democracy and our ability to fight back. So what I want to turn to, though, is I want to make sure that I get in the time remaining what I actually consider to be the bigger threat to our movement and to left movements in general, which is to say that the greater danger of MAHA, in my view, is actually its overall curb appeal. And the fact that it actively taps into ideological territory that is really supposed to be our domain. So essentially, MAHA is appropriating the left's populist rhetoric around, for instance, the evils of big pharma, big agriculture, and big business, and their effects on our health in ways that really resonate with the justifiable distrust that many of us feel towards our healthcare systems. So, I think it's important to really acknowledge that. But the concern is then that they are tying these more legitimate concerns about the influence of industry on our health to really dangerous pseudoscience, right? Like anti-vaccination, questioning accepted public health interventions like fluoride in our water, et cetera, and thereby tapping into the justified distrust of the citizenry in ways that are really dangerous both to our cause and to health in general. So essentially, giving a soapbox to these viewpoints. But what I would like to suggest, and what hopefully we can have some more discussion around, and I'd like to hear other people's views, is that we avoid the trap of opposing MAHA just to oppose MAHA, and instead that we embrace the parts of MAHA that we actually do agree with. So for instance, about the effects of ultra-processed food or industrial agriculture and, pharmaceutical and insurance companies on our diets and well-being. We need to, actually acknowledge that these are things that resonate with people and that also are part of the views that we share. So I've been saying this a lot lately, but I think it's probably worth saying again that the only way to effectively counter right populism is with left populism, right? We need to recapture the populist narrative and pull it back to the left. We really need to be the ones with the solutions when the bleak reality sets in that the emperor has no clothes. Trump and his MAHA mafia have no legitimate policy proposals that will actually improve people's lives. So we know this already, but the public at large maybe doesn't quite know this yet, right? But when they realize this, they will once again be looking for other alternatives. And so we really need to be ready in that moment with the alternatives. I also think, just one final thought, that we need to own our own mistakes as well. There's a lot that the Make America Healthy Again concept gets wrong, but there are also a lot of things that it gets right. And I think public health in particular has really become deeply out of step with public sentiment and increasingly elitist in its outlook. And, in my view, there were many legitimate questions to be raised during COVID, for instance, about the necessity of extended lockdowns and school closures versus how can we use less restrictive measures that resonate more with, health and human rights discourse, or attention to the economic impacts of our interventions on people's lives and livelihoods that were, really ignored or never acknowledged by the public health establishment during COVID. And then more recently, attention to things like banning gas stoves without making more affordable options to people available, or, even more recently over the weekend, recommending that people throw away their Thanksgiving leftovers just days after Thanksgiving. These are just a few examples of how deeply out of step public health has become with the public at large, and, sort of where people are economically and socially. So I think that in order to win the battle, we really have to be prepared with our own slogans and messages and offer a more compelling alternative to the ultra-right MAHA movement. And I firmly believe that we in the Medicare for All movement are ideally positioned to present an appealing alternative to the MAHA movement. But I think it's incumbent upon us now to figure out, what are those messages? What are the messages that will resonate with people? And how do we take back this narrative? How do we reappropriate this rhetoric that MAHA has, kind of stolen from us around being against big pharmaceutical companies and industry influence into our health? So I will stop there, and I'm happy to hear what other folks think.
Betty shared with me that she has some audio difficulties, so I'm happy to jump in if necessary. But Betty, I did see that you unmuted yourself, and Steve, your hand is up. So why don't you go first? While folks think about your questions, please feel free to raise your hand or put them in the chat, and we can read them out.
First of all, I want to applaud Ashley on the points around MAHA's populist messaging. Well, applaud Ashley in general, absolutely, including some of her polling work, which had previously distributed. The stuff around MAHA and the populist message is one I would agree with. And I also want to point out that Dr. Saeed made very much the same points as part of the plenary at PNHP National. So lots of smart thinking people are saying this. And I'm going to drop in the chat some of the language that Dr. Saeed used to say the same thing, because I think it's useful. And lastly, on the public health messaging, agree completely. I think, for example, the very weird mixed message around masks at the beginning of the outbreak was part of what generated the anti-mask response. And, the whole, for those of us that were deeply into it, the whole particulate aerosol thing was completely botched. And that crummy messaging at the beginning, and frankly, anti-science message or bad science messaging at the beginning by our side, which some of us called out at the time, was part of the problem. Yeah.
Thanks, Steve, for uplifting and reinforcing the message. Appreciate that. And yes, joining my thanks to Dr. Fox for being here and for that presentation. So my call stands. Please, questions, comments, thoughts. The chat is open and available to all. And also, please feel free to raise your virtual or real hand. I'll read out Peter's message unless you'd like to do so, Peter. What does right-wing health messaging have to say about the average family insurance premium at $28,000 here in Northeast in 2024? It's probably not, is that a question, Peter, or just kind of an addition to what Dr. Fox was?
What does Robert F. Kennedy Jr. have to say about $28,000 healthcare insurance premiums? I haven't heard a word about that. I think
Republicans have a plan that will reduce premiums.
Yeah, but I'm not talking about skinny insurance policies that don't cover people in an appropriate fashion. I'm talking about real insurance.
That they don't have a plan on.
I guess a direct response to that. Yeah, I mean, I think, yeah, Project 2025, if you read it, I mean, it doesn't have any, it doesn't have any real solutions, right? Like we know that it's just like the repeal and replace movement under Trump 1.0, right? Like it didn't have, he had repeal, but he didn't have replace, right? And he had this American Health Care Act that nobody liked. And although I will say, I mean, it narrowly did not pass, right? I mean, it basically came down to John McCain. And so, that could happen again and be even more unobstructed this time around.
Thanks, Peter. Gloria, I see your hand and then Marva.
Yeah. Thank you, Ashley. I mean, I think what I've gotten out of what you had to say and the comments other people are starting to make is, I do think we have to reclaim, kind of what, the issues that resonate with people kind of in the populace, and never mind about what they say, right? It's kind of like, I don't think we're going to have a counter answer for every single thing, or we necessarily need to. But I would say, like, as a chapter, maybe we need to think about what are the kinds of slogans or phrases or sound bites we can put out that that resonate in a different way, than don't sound necessarily elitist, or don't sound like this is what's good for everybody because it's public health and that means everybody's going to benefit. And of course we all have deep commitment to public health and what that means, but I think, I'm not sure who kind of gave the examples, but I think that it'd be nice to think about that and help each other think about that and how to talk about it in maybe a way we're not used to. Pass.
Thanks, Gloria. Marva and then Peter.
Thank you so much, Ashley. That was really in depth in the amount of time that you had. Great job. I really believe that in order to counteract, Maha and what's being said, is to remind people that they don't really have a plan. All they want is to take away what we already have fought so hard for, and not really replace it with anything that's truly going to work for everybody. So I think the way to move forward for us as a body and as people who are concerned is to rely on the fact that healthcare, universal healthcare, is the answer, no matter what they say, for those of us that live in this country. That if 3/4 of the world can do it, then we can do it as well. And they don't really have a plan. So just show up the fact they don't have a plan. But I think our mandate is the same, that what we believe and what we have to fight for is universal health care. And that's the end and the goal for us. But thank you so much for your work, Ashley. It was awesome.